the CDC is drastically reducing the number of vaccines routinely recommended for all children from 17 to 11. This follows a controversial December recommendation on when infants should receive their first dose of the hepatitis B vaccine.
Yeah, this also goes back to the flu shot, because now also just something you can get if you want it.
Right.
If not, you don't. Health Secretary RFK Jr. said the announcement protects children, respects families, and rebuilds trust in public health. The American Academy of Pediatrics called the change dangerous and unnecessary. Joining us now is Dr. Yvonne Maldonado, Professor of Pediatric-infectious diseases at Stanford. Thank you so much for being with us this morning.
Morning.
Can you tell us what this new vaccine schedule actually changes for parents of young children right now? Are there insurance implications? Can you still get the vaccines if they've been removed from the list?
Well, so far we've gotten some very sketchy information. We still don't really have details about operational impact, but it's certainly going to affect scheduling for families and children. So basically what the CDC and the Health and Human Services have done is to take away 6 vaccines from the recommended list to the either high-risk group or to a group that is called shared clinical decision making, which means you can talk about it with your doctor, and if you choose to do it, you can do so. Now remember, no vaccines are absolutely mandatory, so they already you can already discuss these with your doctor. But what this does is really take that level down a notch and say, well, these 6 vaccines really probably aren't that important, and that's concerning to all of us who take care of patients, who take care of children, who do public health policy in this country, because now what this looks like is that these vaccines may not be seen to be as important for families and children, and that's absolutely not the case.
Very interesting. So, of course, there is concern, as we're saying, from the medical community about what this means, especially when it comes to the shared decision making you talk about. Does this mean parents are going to have more conversations with pediatricians to make sure their children are healthy in basic ways?
Well, we already do that. The American Academy of Pediatrics represents over 67,000 pediatricians in the country, and we all know how to talk to families and patients. We spend a lot of time educating patients and families, so that's already part of the vaccine program. But what this does is really, in some ways, makes it a little harder, because now that there has to be separate kinds of documentation, and families may have to fill out more forms to opt out or in for vaccines. So it makes the process much more difficult. Now, remember, these are diseases that still kill children, put them in the hospital, put them in intensive care units. Over my career, I have seen children not only in the intensive care unit, but die from these diseases. So they're not meaningless diseases. They're really impactful, and we are so successful right now at preventing them because these vaccine schedules are highly recommended, and reducing the recommendation level is really dangerous.
Well, that's the current administration, though, is saying that this will rebuild trust in vaccinations. Critics obviously warning it's going to create confusion, as we're talking about. But from a public health standpoint, which outcome in your mind is more likely? Do you think with this kind of being scaled back, some parents may then see the importance of it?
Well, one of the things that this administration has done over the last year or so is really make vaccines sound scary and unsafe. And that is really incorrect. These vaccines are highly safe and effective. And the overall messaging has been subtle in some ways and ham-fisted in others, but essentially they are not making vaccines sound safe and effective. And that's the biggest problem here. So the issue again is that supposedly these vaccines will still continue to be available, and still continue to be available for free if you need to have them covered by the federal government or by your insurance company. But over time, it really loosens the ability of people to get them. And that's really what we're worried about, is this high level of protection that might be needed to prevent, say, a young baby under 2 from getting hospitalized, for example, with RSV, which is a really serious respiratory infection in some children.
Right. Now,
one other thing that happens is that this putting children in high-risk categories is misleading, because RSV is the most common cause of hospitalization of children under 2 years of age in this country, the most common. And yet there are 80% of these children have no risk factors. So if you try to identify risk factors for vaccination, you're going to miss 80% of the kids in this country who could be at risk for being hospitalized.
All right, very concerning, but this is the new guidance. Thank you so much for joining us, Dr. Maldonado, with your thoughts on it.
Thank you.